So all information will, of course, be removed, and there will be no faces and no voices. So please feel free to speak up or write anything in the chat. And off to you, Karen. Apologies. There we go.
That's great. Thank you so much, Erin. As Erin said, my name is Karen Nunn Perry. I live in Dartmouth, Nova Scotia, but I actually spend a lot of my time recently at our cottage, which is where I'm at right now. And the background is our lake in the evening. So I'm a caregiver to my husband, Ben, who is a stage 4 pancreatic cancer patient. I'm very blessed and happy to say he's currently has no evidence of disease. Of course, though, it's been a trying few years, but I'm really looking forward to having this conversation today with other caregivers, because I think it's kind of a topic that should be discussed more. And I liked the title of the conversation today, Caregivers, the Forgotten Patients, because sometimes we don't put enough focus on caregivers. So yeah, before we get into the questions, I'm just going to start with the other caregivers in the group to introduce themselves. So Bethany, if you want to do a short introduction.
Sure. Hi, everyone. I'm Bethany Cutler. This is my dad, Barry, back here. We are in St. John's, Newfoundland. My mom was diagnosed with stage 4 pancreatic cancer just about 2 years ago at the beginning of August 2022. She passed sadly on May 5th, but Craig's cause was an incredible resource to us. We learned a lot along the way. So we're just here today to honor her and hopefully give back a little bit.
Thank you, Bethany. Lisa?
Hello, I'm Lisa Herndon. My husband is Rick Herndon. I'm his caregiver. He was diagnosed with stage 2 pancreatic cancer, and he had 6 months of chemo, and then he had the Whipple. And knock on wood, no evidence of disease since then. That was in August of 2022. And we live in Louisville, Kentucky. And I'm just really glad to be here today. I really appreciate the opportunity to participate and hopefully help some of the caregivers, current caregivers.
That's great. Thanks. Thanks, Lisa. And Linda?
Hi, I'm Linda. My sister got diagnosed. My sister Heather got diagnosed in February 2023 after feeling sick for quite a while. And I became interested in Craig's cause because we were looking for answers. And then Heather became involved in it, and it's been very useful to us. It's really helped the support. But Heather's still chugging along, going at the chemo, and we're thankful to have all these new friends. And I should say too, I'm not a main caregiver. I'm more of a support person for Heather.
Linda, you are a caregiver, just so you know. So we have a series of questions here. I'm not sure if we'll get through them all, but we're hoping it's going to be more of a bit of a conversation. We're going to kind of take turns answering the questions ourselves. And, we're just basically going to give our own personal thoughts on each question. And of course, at the end, we'll be happy to take any questions from anybody tuning in today. So our first question is, and I think maybe Lisa, I'll ask you to go first when I finish the question. So caregivers can find a cancer diagnosis of their loved one just as hard to cope with and accept as the person diagnosed with cancer. Lisa, how did you react to your loved one's initial diagnosis, and what were some of the emotions you experienced?
Well, our situation was probably a little different from most in that it took almost a year after when Rick first started having symptoms to get a definite diagnosis. He had 3 biopsies and several procedures. And so when we finally got a diagnosis, it was almost a bit of a relief, because it was like, okay, now we know what we're dealing with. We can start to do something about it. but at the same time, it was, it's very shocking. And as Aaron mentioned, this is not the first time that we've had to deal with this, although this was certainly a more serious situation. So um, it was, it was a blow. But his surgeon was actually the one who ended up giving the diagnosis, because his his GI doctor sent him to a surgeon because he couldn't figure out what was wrong. And this surgeon told us, that he was definitely a candidate for the Whipple. And so that really kind of gave us some hope, a little bit of hope going forward. And I just kind of grabbed onto that hope and thought, well, we'll just get through this as best we can. So, but that's, I'm a little different. I tend to not react to things very emotionally, if I can, most of the time. So, but it was a blow. I mean, anytime you hear those words, that's hard for everybody.
Did you feel like the second time around, not that it's any easier, but did you feel a little more prepared, I guess, for what you may be faced with?
Well, it was such a different, I mean, he had prostate cancer the first time and he had surgery, but he didn't require any chemo or radiation. And, hearing that he had to go through chemo, we knew that was not going to be easy. So that was a tough pill to swallow. But I don't know, because it was so different. I don't know that I was really any more prepared for it, except just, like I said, it just took we lived so long without knowing, that it was almost a relief to finally
I can
hear.
definitely, I can definitely appreciate that.
Mhm.
Bethany, how about you? How did you react, and what sorts of emotions were you experiencing?
So we knew from diagnosis it was stage 4. And mom they told her shortly after, the life expectancy is 15 months. My reaction was disbelief, obviously. Like, mom was 61. She had never had any health issues. Like, when we went to see the doctor and they looked at her medical records, they were like, is this it? Because she just had never had any issues before. So it's disbelief for a while. And then, like, incredibly sad. But then once you kind of get over that, it's like, okay, well, what do we know? What do we do now? Like, how do I make this easier? Um, you go on Google and it's like all doom and gloom out there.
Oh, yeah.
So what can I do to make this either any bit easier? And you kind of just, I guess, find a purpose, or I did, in that.
Yeah, I feel like that's the experience of a lot of people, that shock is just like a shock wave. And it's amazing how we kind of eventually get to some acceptance, and then you just sort of turn your focus on to, okay, what now? And then it just becomes a new normal.
Yeah, and it's like, how do you balance, like, trying to accept the prognosis with trying to keep a bit of hope,
Absolutely. Linda, how about yourself?
It was very shocking. I remember I felt really angry at the beginning because Heather hadn't been feeling well for so long, and it just seems to take so long. She was waiting to see a gastroenterologist, and just a few months back, she finally got an appointment, but she had already been diagnosed over a year with pancreatic cancer. So it made me angry, that because I knew she wasn't feeling well and couldn't seem to get to the bottom of it, and tests were put off. And anyway, and then it was the shock, because you always hear such negative things about pancreatic cancer. And then if you start reading things, there's not a lot of good news when you read about pancreatic cancer. So then you have to stop yourself from reading stuff, because a lot of it is negative, but there is hopeful, like this, especially even joining this group, to see the hope and to see the people are surviving and surviving longer. Yeah, I think, and I'm lucky I have a good sized family, so we support each other. And I guess being a nurse helped me to sort of look for ways to help Heather. So at first it was, yeah, anger, then sort of acceptance, and then your bargaining sort of thing, like, okay, well, if we can get through this next scan, there's more hope. And yeah, it's quite an emotional thing, and it's a long time emotional roller coaster because it just keeps going. But anyway, this
Yeah.
group has really helped.
For myself, my story is similar to Lisa's in the way that Ben had been experiencing symptoms for several months. I was concerned about it. I was encouraging him to go to the doctor. The last thing I thought of, though, was cancer, to be quite honest. I just thought he had some gut issues or what have you. It really wasn't until he turned jaundice that we were then taking it very seriously. The day that he got his scan back from his doctor, and it was just an ultrasound, but from the ultrasound, the doctor could see that there was a growth on his pancreas, and he basically said, just walk yourself into emerge. Even then, I wasn't like that concerned. Well, I was concerned, but I wasn't, the whole cancer thing didn't hit me until that night. And he had a CT scan, and the doctor came in to give us the news. And my heart just sank. I have a history with panic attacks. I went into full panic attack mode. It was so bad, I actually almost had to get medical care myself. And for that whole week, I could not sleep. He had been in the hospital, getting further tests, getting a stint in. I had to have my best friend come and sleep with me. It was just that sick feeling of dread. And it did take a while to kind of turn that corner. Although at first we kind of thought he was going to have surgery, and then there was, some hope involved. And then those hopes were dashed when it was only a couple days before Christmas, and we were told, no, it is the endocarcinoma cancer, and it's stage 4. So, we got that get your affairs in order thing. So yes, mostly I was scared for him, for what he was going to experience. And of course, I was just devastated and so afraid of losing him. And yeah, so those were my initial feelings. So the next question is, caring for someone with cancer isn't easy. It often involves taking on many new important responsibilities, such as physical, mental, and logistical support. It can go on for a long time, many months or even years. It's not something you expect or plan ahead for. What has been the hardest part of becoming a caregiver for your loved one? And this time I'll start with Bethany.
I am naturally a doer, like whatever the tasks are that need to be done, like I just do them. So like I just took everything in stride mostly. But because I am that way, the hardest part for me was acknowledging, trying to make peace that like this was something I couldn't fix. Because I'm just used to fixing the things. So that was the hardest part for me. But once you kind of realize that, like it's out of your control, there's all these doctors who can't fix it. How could I? That was the hardest part for me. But once you realize that, it's like, okay, what is within my control? What can I do? How do I make the inevitable easier, kind of thing? But that being said, like I worked basically throughout. So I'd work, I would go to my parents and prepare meals, clean up, do what I need to be doing, go home, go to sleep, work. It got a bit like Groundhog Day like that. So there were times definitely where it just felt a little overwhelming and too much. And sometimes you just have to take a step back, take a mini break, and just say, I got to get my head straight so I can come at this again.
Absolutely. And we'll talk more about, taking care of our own mental health in a question soon. Linda, what has been the hardest part of becoming a caregiver for your loved one from your perspective?
I think one of the hardest things is, like Bethany said, it's not being able to fix it. Like I find nurses often are problem solvers, and we can find ways to fix things or make them better or ease people's pains or their fears. And the hardest part is you can't sort of get medical personnel to do what you want. Like say my sister's having abdominal pain. Well, I would think it would be nice to get her in for an ultrasound and they could see if that's give her some peace of mind, see that it's not the cancer that's bothering her, that it's something else. But so it's the hardest part is to sit back and sort of just be a support person, whereas you're used to fixing things. And I think that's what I find most challenging. But then I've learned to help with symptoms. If she's not having a good day, sometimes just going down and have a cup of tea. I'm fortunate that my sister lives in the same apartment building that I do. So yes, so if she's having a bad day, I can pop down there and chat with her, or go sit with her at chemo, or do things like, or find something to help her neuropathy in her feet. So I think by helping her sort of get through some of these things, like even to navigate the illness, I think that's been helpful. But it's not being able to fix it. It's the most hard thing I find.
Yeah, I think that would be a common thing among all of us. Lisa, and your thoughts?
Well, yeah, the helplessness that's hard because you see someone you love suffering, you want to fix it, you want to make them better, and you can't do that. But probably the hardest part for me is that Rick is such a good patient that it was difficult for me to determine sometimes whether I was helping him or making him feel like an invalid because he wouldn't always tell me, how he was feeling and if he was feeling bad. And it's kind of, that's kind of a hard line to walk. Um, I probably struggled with that more than anything else, was just figuring out, what he needed me to do and making sure that I wasn't doing too much or more than what he needed from me. And also when he was in the first, when he had pancreatic or prostate cancer, I always felt like I pushed him too hard. I was so afraid that he was going to get depressed and, you know, because he was just sitting in the house recovering from surgery, that sometimes I think I made him get out and do things when he really, really wasn't up to it. So, but I did learn from that experience this time around. Then I didn't try to push him too hard. But yeah, that was the hardest part for me, was just figuring that out.
It's funny how well, it's not funny, but like different people with different personalities, and sometimes that's where the struggle is, where like, Rick may not have said one way or the other, but I'm just fortunate with Ben. Like those who know Ben know that Ben just says what's on his mind. So I was very fortunate in that was never an issue for me. If he wasn't feeling well, he would tell me. You know, um, if he wanted to do more, he would. For me, the hardest thing after the initial shock and devastation, of course, was worried about how am I going to do this? Like I wasn't worried about the actual physical doing things. I wasn't even worried about the emotional support. It was like how, because I was working full time and I didn't know how I was going to have a job, but yet take care of my husband at the same time. So for me, it was, I just didn't know how I was going to do that because I knew I had to be there for him. But at the same time, you get this diagnosis of, oh, you might live a year if you're lucky. So it's not like I can give up my job, but I'm very fortunate in that I have a really good sick leave plan. So I immediately, well, it didn't take long to figure out I needed to take some time off. And thank God I did because that for me really, really helped. But otherwise, wise, initially, the hardest part was just that whole adjustment and how am I going to do this while having a full-time job? So the next question, and this is going to be on the little positive side of things. The responsibility of caregiving can be overwhelming and stressful, but it can also be very rewarding. What has been the most rewarding part of becoming a caregiver to your loved one? And this time I'll start with Linda. You're on mute, Linda.
Sorry. I think the most rewarding part is helping her navigate her illness and help her to find supports. I actually found Craig's Cause. Somehow I read about it and I joined, and Heather wasn't ready to join. And I started going to, and people were really helpful. And finally Heather did join. And we've learned so much valuable information from Craig's Cause. And it's hard. Yeah, we met friends. And the thing is it's hard to understand the standards of care for pancreatic cancer. We didn't know anything about genetic testing. There were so many things, even from the help with the neuropathy, there were so many helpful things that we learned from the group. And I think the rewarding part was seeing Heather become engaged, seeing Heather help other people too in the group. Everybody helps each other, and it's fabulous. It really is. So there's not a lot of rewarding things, but the rewarding things is when you can help somebody feel better, you can help them understand why they're doing a test, just things like that.
Yes, for sure. And, I'll give a plug for Craig's Cause too. Like for me, the most rewarding part was that whole helping of other people. And almost immediately too, I went into research mode. And so for me, learning the most I could about cancer and pancreatic cancer, where some people they don't want to know. For me, I had to know, had to research, I had to look at the different options, because in my mind, it's like, what do you mean he's going to live a year? Like that can't be possible. So I just kind of dove into research. And while I did that, we started looking into things that were beneficial for cancer patients, such as, avoiding chronic stress, getting exercise, eating right. And one of the other kind of coping things that we did that we found very rewarding is that I take my mind off things. I started making these cancer bracelets, and I made a couple of them and I shared them on Facebook, and people said, why don't you sell these? And I'm like, geez, I don't know. Anyway, I decided I would start making them. And before I knew it, I had hundreds of people asking me for these bracelets. At the end of it all, we raised $4,700. And I was like, okay, well, where's the money going to go? And that is how I found Craig's Cause. And that was kind of the beginning of our journey with our advocacy with Craig's Cause. And yeah, so ultimately just doing those things to help others, being engaged, that for me has been the most rewarding part, and it continues to be. Just even doing talks and having conversations like this, it just makes you feel like you're doing something for the broader community. Bethany, how about you? What's been the most rewarding part of becoming a caregiver for your mom?
Well, it puts everything into perspective, right? Like what's important, what's not, to be deliberate about how you spend your time, what you choose to do. I know how much comfort I gave my mom, and I take a lot of comfort in that now. So it was very hard, the hardest thing I've ever done for sure. But I wouldn't have wanted to be anywhere else.
We're happy that we had her here, because without Bethany Christopher, I just wouldn't. I don't know where I'd be.
Yeah,
probably would have it.
it, yeah.
Well, and that just highlights the importance of caregivers. You know, and it- it's so sad that your mom is no longer with you, but you know, I hope you know in your heart of hearts that you were there from her, and obviously being a wonderful support for your dad. And it's kind of a bittersweet thing, you know, that
And
should feel good. But
you too,
you got
like
the
you have the conversations and you don't leave things unsaid, because you know what's coming, right? So
Mhm.
a lot of people might not ever have those conversations. So it just, I'll take that to other relationships, and it's a very, very difficult lesson to learn. But ultimately, everyone's time is ticking, and you know, just spend it doing what you want to do, and make sure you tell people how much you care about them. So
100%.
It's important.
100%. Lisa, for you, what's been the most rewarding part for you?
Oh, it's been knowing that I was able to make this journey easier for Rick. Uh, he told me one time that, it made him feel better just having me there when we were at doctor's appointments or chemo, and that really meant a lot to me. It made me feel like, everything I was doing was really helping. And I found Craig's calls. I was like you when we found out. I started researching everything I could, and that's been just fantastic, because now he's able to help other people who are going through what he went through. So it's really it is very rewarding, just to know that you've been able to help.
Yeah, it's a really
Mhm.
good feeling, and it helps us cope with the hard side of things.
Mhm.
Linda?
Um, just like what I mentioned earlier, I just find it's just rewarding and finding ways to help others and to help Heather like manage her symptoms. It's just it when you make her laugh when she's having a bad day, it's a good feeling. When I see Heather on the Zoom with Craig's Cause and giving advice about better protein options for people to take because they're having a hard time gaining weight, or talking about managing symptoms to other people. So it's rewarding that everybody's reaching out, helping everybody. I like that part of it. And yeah, that's, I guess, just making everything try to be more positive is yeah.
Yes, for sure.
Oh, and being my sister, she's sitting with me too. We sit together all the time. She's saying and being there to listen. Like when she's having a bad day or something, sometimes her husband will call me and say, come down and see Heather. She's having a bad moment. So I'll go down and I'll get her out of it, and we'll figure out what to do and make a plan. And then it seems to get a little better. Oh, I am lucky to live in the same apartment complex, so it's easy to get down there quickly.
Yeah, I didn't know that. And what a blessing for Heather to have you so close by.
That's great. It's great if you
Yeah.
forget you need a cup of sugar or something. You just drop down. And
Yeah,
get a
that
cup.
too. I need an egg.
Oh, I need supper. Can I come down for supper?
Yeah, for sure. Um, so the next question kind of turns to us and our own mental health. Caregiving can be a very intense and tiring job. While you're caregiving, along with everything else you have to do every day, you may forget to take care of yourself, but it's very important to make sure that you practice self-care. What are some positive coping mechanisms you use to ensure you remain mentally and physically healthy? Lisa, I'll start with you on this one.
Well, I'm probably not the best example of coping because I gained 40 pounds from stress eating. I've lost 24 of those since, but um, one thing I did was I got back into therapy. I've had therapy on and off throughout most of my adult life, and I had to get on some anti-anxiety medication because my symptoms they were getting difficult to control. but both of those helped tremendously. And I think we even talked about this on Wednesday. You need to have someone to talk to who is not related in any way to your situation. You need somebody that's impartial, that can just sit there and listen to you. And yeah, that helped. That was probably the biggest thing of all that helped. Because as we
Yeah,
all know,
yep.
caregivers, there's a lot of things that go through your mind that you can't say either to the patient or to your family members. A lot of times even to your friends if they, if they're friends with the patient too. So that would be my recommendation to anybody going through caregiving for someone with cancer, is to definitely get your own mental health help.
And never underestimate the power of just having somebody you trust just to sit and listen to you. You know, they might not have the answers, but just being heard,
Yep, just
I
saying
think
it out
is
loud.
just, yeah,
Can
letting
make
it
a
out
difference.
there.
Yep.
Bethany, what about you? I mean, especially now that you're dealing with grief and all kinds of sorts of emotions, how are you looking after yourself?
I got a therapist immediately when mom was diagnosed because, for the same reasons that Lisa had said, like, you don't want to burden your friends and family, even though I have an incredible support group in that sense. But this is one of the things you need a paid professional for. And I still am not returned to work. I'm going back to work next week. My work also had a generous sick leave policy. So I took the time to try and heal a little bit and just decompress. Like the last 2 years, you're so deep in it and you're just going day by day and you're just dealing with things because they need to be dealt with. But once it's all over, you're like, what was that? And it I'm still trying to get back to myself a little bit.
Yeah, I think being able to take that time for yourself is so important. And, some people don't have that. And my heart goes out to people that just can't take time off because, it really is, I think, a huge part of recovering and getting through that. Um, who did we already get through all of you? Is it my turn? Or Linda, did you?
Didn't
No,
mention anything
Linda's
yet.
next. Yeah.
Okay, basically, I find that by going to work, it helps a lot. Like, I know what Bethany, where you're saying it helps to take time off, and I lost a brother several years ago, and I needed time off afterwards, and I found it especially hard when I got back to work because everybody was asking me about him, and then I was going through I sort of thought I healed a little bit, but then I was going through sadness all over again. So I'm lucky that I have some great coworkers that are also nurses. And so they are so helpful to talk to. And they don't really know Heather because they're my coworkers. So they've been very supportive, sending cards to Heather and just ask me how she's doing, how her scans are going. And I think it's really important to have somebody to talk to because you can't always necessarily even talk to your family because we're lucky to still have our parents alive, but we have to be very guarded in what we tell them because we don't want them to fragile and we don't want them to stress. So if Heather didn't have a good scan, we don't want to say that she didn't have a good scan. We want everything to seem hopeful to them. You really need to maintain the hope in this whole thing. But yeah, no, I'm lucky I have people to talk to, and I've got another great sister and brother, and we're a very close family. So yeah, but find somebody to talk to. Just don't hold it in yourself.
I mean, you make a very good point about work also being an outlet.
Yeah,
As much as I needed to take the time off for myself when I did, I also had a very wonderful support system at work. And again, not everybody has that either, but I was very blessed to, at the time I was a team leader, and I got to say I was leaning on the team that were below me more than, they were leaning on me. And I'm so grateful that they were there for me as well. So for me, directly after, when this whole thing blew up, I also went and I got therapy like right away. Because I was going squirrely. I didn't know what I was doing. So getting the therapy kind of really brought me in, helped me think about things, helped me go through the different emotions, and just getting out of my own head and doing things that kind of make me self-remove from it. Just like, and Ben and I would do it together. There were several kind of building projects we would work on together. And like some of you may know, we have a couple of campsites that we have now. And through that whole time, that's just kind of what we worked on. And it was just a really great outlet, building things, creating things, and just kind of stepping out of the realities of life. I also have a very good group of friends as well that I turn to. So, and of course, the advocacy work that we're doing with Craig's Cause and other people we're in touch with, even just talking to other patients, that for me is a form of therapy. People say to me, "Oh, thank you, like thank you, you're helped me so much," and I'm like, "Well, yes, you're very welcome, but you don't know how much you've helped me too." So, um, just making sure that I'm taking care of myself enables me to be the caregiver that I need to be. Okay, on to the next question, and we're rolling along pretty good here. We might get them all done, which I'm really impressed about. So the next question is, once the reality of a cancer diagnosis sinks in, you begin living your new normal. You learn to live one day at a time. That is until the next scan is on the horizon and anxiety begins to creep in. How does it impact you, and how do you deal with those anxious feelings? Lisa?
Well, that's something I'm still working on, honestly. We do pretty good. We just try to keep things as normal as possible, and we don't talk about it a lot. But we're lucky in that we usually don't have a lot of time between the scan and his doctor's appointment. So that helps a lot. I know there's people that have to wait a long time, and I think that would be just torture. But, I really have not figured out a way to really deal with that time in between. So I guess really if anybody has any tips, I'd like to hear those.
I have to echo what you said because, every scan comes up and, scan anxiety is a real thing. And I've not really had a real good way to cope with it other than trying to keep your mind off of it. So for us here in Canada, at least in Nova Scotia, you get your CT scan and then you got to wait 2 weeks to go and get the results. So for me, it's like everything seems to be going okay until the day of the CT scan. And then as soon as that CT scan is over, then the next 2 weeks, it starts to creep in, the anxiety, and you don't even know that it's there sometimes, but you got this sick feeling in your stomach, and then you're like, oh, right, like I think that's what it is. So I think half the battle though is recognizing that you are anxious so that you can say to yourself, okay, you're anxious. Now what am I going to do about that? And Lisa, I think you're right in that you just sometimes maybe it's better not to talk about it, to just go along your day as if it was every other day. And that's pretty much how we do it too. But you're right. It's still a challenge, and it really doesn't get any easier, I don't think. Bethany, how about you when your mom was going for scans? And for you, I guess a little bit different, especially where coming near the end when she got really ill and
Mom was like very much a realist, and I get that from her. So it is what it is. Don't worry about something that's not here yet. Try to like put it out of your mind, distract yourself. Watched a lot of Jeopardy, that kind of thing. So just trying to, I guess, let go and let God in a sense, as much as you can. But then also like through like seeing a therapist, whatever, when things get overwhelming, like they teach you different exercises and like things you can do. And like I talked to my family doctor and she gave me some Ativan, like it just there are like practical tools like that. Um like when it all comes down to it, once the scans start showing growth, it wasn't, I don't know, it's just a big process, I guess. Like, yeah, we just tried to accept it as it came. And we're probably still trying to do that.
For me, it was prayer. I prayed and prayed every time there was a scan. You know, that was good news. When the C19 numbers are going down, I was on cloud 9.
Mm.
It went to radiation was 2,500, it went down to 216. And then started going back up. Now, I'm not a religious person per se, but I believe right until the last 2 weeks. And then I just, to myself, I'm a person that keep everything to myself. I talk to nobody. And the last 2 weeks, I gave up. I thought, well, God is not going to help us now. But Heather used to always say, just in the end, to watch for signs. And I wanted to share with you, and I've told Ben already. When she passed at home, and I wasn't able to watch her bringing her downstairs. And I thought first we were going to have her wake, and then Bethany said, "No, Dad, Mom,
keep it quick."
Yeah. So anyway, I went back to the funeral home, and Bethany's friend is the owner. So anyway, he let me go back in. I took 4 pictures, and I look at them daily. And at one point, I was sharing them with a customer, and a white light came right around her head, all around, bounced back and forth. Now, whether this is something with the phone, I don't know, but I guess that was one of the signs. And
Oh, Barry, thank you so much for sharing that. Ben did tell me that story, and it made me emotional. It still does.
yeah,
But thank you. And Bethany, you touched on something there too about coping. Like sometimes we do need an extra bit of help, and whether that's medication, because I certainly didn't shy away from that, and it did help me get through some of the worst days. And just back on you, Barry, to touch about whatever your religious or spiritual beliefs are, having that time for prayer or meditation, or putting your faith elsewhere, that in itself can be a great comfort. So yeah, thank you very much. Who did I miss? Who didn't speak on this question yet?
I think prayer helped me too. Like if, a scan, I'm not terribly religious, but I'm spiritual. And I found like if I really prayed and really hoped, and that it just helped. And also if we all kept busy, like if we knew Heather had a scan, then we'll all try to go to lunch. The sisters will all try to go to lunch, or we'll go try to do something, or go for an ice cream, or go just try to keep busy. Sometimes we even watch movies together just to keep our minds off worrying about the scans, and just having hope, like just really encouraging the hope too.
Wow, thank you, everyone. That was a good one. So the next question is basically about treatments and support. So when our loved one is diagnosed with cancer, many of us dive into reading everything we can about pancreatic cancer so we can learn how to support them best. When deciding what, if any, treatment plans to explore, we don't always agree. How do you balance supporting your loved one's wishes with encouraging them to explore other options, such as maybe a second opinion or clinical trials or, anything else that may apply to your circumstance. Lisa?
Well, I don't know that we have ever disagreed about treatment. Although there were times where I thought maybe there were some things that could help Rick that he wasn't always as receptive to as other things. But I just had to realize that he's the one that's going through this, and he knows what's best for him. And if it's something that he didn't think he should do or needed to do, then I had to accept that. But now, as far as, I don't know how you would deal with it if you had a loved one who was sick and was not going to do what they needed to do. I think that would be really difficult. But I guess ultimately you would have to accept that they're the ones with the illness, and they have to do what's best they feel is best for them. I think that would be really hard to watch, to see, but I guess you would just have to ultimately accept it.
Very true. And
Mhm.
I'm on a lot of different Facebook groups, and you hear a lot of loved ones talk about their frustrations with, their loved one, and what they should be doing this and they should be doing that, or they don't want to have any more treatment. They're going with quality of life instead of quantity. So those, I guess those challenges do exist within families. For me, I was very lucky. Ben pretty much agreed with anything I suggested or said. I was the one that kind of dove into the research, so he did put that trust in me, thankfully, and maybe too much trust. So just things like his diet, like looking into the foods he was eating, and come to find out that yeah, there are certain foods that were not agreeing with him, and not that that was curing the cancer, but it was helping his I guess immune system build back up a little bit so it can fight the cancer. So these are just different things we looked at instead of just regular standard of care. We did look outside the box a little bit, and not everybody is comfortable with that. For us, it was worth it because with the prognosis of you have less than a year to live, like Ben would say, if someone told me to eat porcelain, I would if they thought it would work. So for us, even if it was going to cut his life short, we knew that it was together. We agreed that we'll do whatever we can. We'll throw the kitchen sink at it. Bethany, how about yourself?
I also did a lot of research and talking to different people about like off-label supplements. I wish that my mom had been open to trying it. She wasn't. I brought it up to her multiple times, but she was a nurse, so she would say she trusted, standard of care pharmaceuticals. She would say, why don't you go to a naturopath when you're diagnosed with cancer? So, it just got to the point where it wasn't my decision to make. And like at the end of the day, I can look back and say, do I wish she had done it? Yes. But I took it as far as I could. And then like it would make her stressed out sometimes thinking about it. So like, I don't want that either, like it's ultimately her own decision. And I said, here's what I think. Like I arranged calls with a few people who had done those things and had positive results. But at the end of the day, she was too nervous, and that was her own choice. So you just have to kind of accept that. And instead of harping on the subject, I just said, okay, well, if you're not like, we'll continue going down this path and focus on, one day at a time, spending the time that we have together.
Yeah, it's a really fine line, because as a difficult situation as it is, you're both experiencing distress and pain, but from a different perspective. Like it's it's the same but different. So, but you're right, at the end of it all, you have to respect and do whatever it is that they feel is best for them. And so yeah, it is what it is, I guess. Linda, how about you? Have you had disagreements
sometimes
with Heather
yeah,
as to?
we've had disagreements on a few things, um, but it is Heather's. It's what she wants, whatever she wants. She's a grown adult and she can decide for herself. Luckily enough, it's not something like, I can't imagine if you were with somebody and they didn't want to have treatment and you wanted them to have treatment, that to me would be a really hard decision, or hard thing to sway somebody over to. A few things that I've suggested Heather hasn't wanted to do, but then she comes around, she'll say, okay, let's do that. So I think, just being open, show them research that why something might help, or why talking about things can help. It's all very helpful, but ultimately she's her own person. So her decisions are what counts. And you have to respect that. You have to respect it.
Yeah, you hit on something really useful there, because it is a fine line, but I think it is important for you to get your opinions out there. But then sometimes I think you just need to get the opinion out there, say what you need to say, and then just let it drop and let it percolate.
Yeah.
And
And that's
if
what happens.
the person comes around to maybe agreeing with you, great. If not, then I guess that's okay too. But just I think it's important to still give your input, even if at the end of it, they don't agree or want to take
Yeah,
your
at least you've tried.
suggestions.
At least you've tried, right?
Exactly. So we are getting short for time here. So there's two questions left. So I'm gonna skip to the very last one, because I think it's one of the most important ones, especially if we have other caregivers on the call, and I know that we do, because I see one on my screen here. Terry, I spoke to Terry the other day, and I only see a select number of people on my screen here, so I just recognize Terry's face. In any event, the question is, for my caregivers here on the call, after everything you have experienced during your journey as a caregiver for your loved one with pancreatic cancer, what piece of advice do you have for other caregivers that you wish you had in the beginning? Bethany, I'll start with you.
Two things. First, I read something somewhere along the way that said basically, like, instead of focusing on how much time you have left, focus on the quality. So think about like being present and not thinking, is there 6, is there 8, is there 10 weeks? Like, be in the moment, and be present, put your phone down, that kind of thing. The other thing I would say is, when it comes down to it, you are stronger and capable of so much more than you think you are. Like, my mom wanted to come home out of the hospital, and they were saying, like, they said to me, are you sure you understand like what's involved with this, and are you able to give the medications, all those things, and why don't you wait until Monday? And we got her home Friday night, because I pushed and I said, no, mom wants to be home, we're going home. And we got her home Friday night and she passed on Sunday morning. So there are times as well where medical professionals know medicine, but your loved one. So that there are going to be times when that trumps everything. And don't be afraid to advocate for that.
Everything you said like rings so true. And yeah, it's great advice. Lisa, how about you? What piece of advice or suggestions do you have for other caregivers that you wish you had in the beginning?
I think the biggest one is don't ever underestimate how big of an advocate you need to be with your medical providers. They think, this is part of their job. They see this stuff every day, but to us, it's life changing. And, you know, saying, oh, you know, I'll email them. Well, you know, they're busy. I know, you know, I know they're not responding to me because they're busy. I'll just wait. Well, you know, if you think you've been reasonable in waiting, then ask again. You know, call somebody. Don't just sit back and wait for them to come to you if you think that you waited long enough. And be super vigilant with everything, but especially instructions. Like, for example, when Rick was discharged from the hospital after his surgery, well, it had on his instructions that he was supposed to be taking like some kind of an antacid. Well, nobody ever went over that with us. And, you know, of course, it's 17 pages or whatever, and we missed that. So he was having problems, you know, with his stomach. And we went we went for a follow up, and the doctor said, well, are you taking whatever this is? Well, no, we didn't know he was supposed to. You know, you just gotta stay on top of everything. And he also got discharged from the hospital without any pain medication, which we were told that had been called into the pharmacy. So you just gotta, you know, I mean, he's had excellent medical care, but it's still, things can fall through the cracks. So don't ever become complacent when you're dealing with medical professionals. And another big thing is, don't be afraid to ask for help, because you'd be shocked at how many people want to help, but they don't know what to do. So if you ask them for something specific, more often than not, they'll be there to help you with it. Don't feel like you have to do it all on your own. And actually, a third thing just popped in my head is, when you're acting as a caregiver for somebody with this serious of an illness, don't feel like you have to be everybody else's caregiver, because I'm sure we all have people that need our help or want our help. But if there's somebody else that could step in and help those people, let them do it. You don't have to take care of everybody, or that will not work in the long run. So
Yeah, you hit on some really important things there, like putting up those boundaries, because I know once you're overwhelmed and you're so involved in your own stuff, you know, things that you once were able to do for people, it's not possible anymore. So you have to put up those boundaries. And the other thing I'm very glad you mentioned was the advocacy, being an advocate for your loved one, because that's actually the question that we skipped over, was basically about how to be an advocate when, you know, in many situations it's hard to be, given our you know, struggling healthcare systems. I would put that kindly. So yeah, thank you for bringing the advocacy, the importance of that up. Linda, your advice?
One of the things at the beginning with my sister, her rapport with her oncologist wasn't great. And I think that set things back a little bit for us until we came to Craig's cause. And it was suggested maybe Heather should go for a second opinion or to see another oncologist. And that was a tremendous help. That was changing. It was perfect. So I think if you're not comfortable with the doctor that you have, and there are doctors available, then ask for them. Advocate for information. Find out standards of care for. Sounds like all over the place they have different standards of care for pancreatic cancer, and to understand, like, why do they do radiation in one place? Why do they not do radiation here? Just different things, or why do they start with this drug and then they start with that drug somewhere else? And even for the oncology group to give information out about Craig's cause, because we just found it by looking online. It wasn't sort of suggested by the oncologist, but probably eventually it would have been. But yeah, just it would be nice. Like, I work mostly with pediatrics, And in kids that have cancer often have navigators. They have family care coordinators, and the family care coordinators, the contact for the family, so they can, if you have questions, you can go to this family care coordinator. I know they're trying to do that in the adult oncology thing now, but it would be so nice to get help after hours instead of being directed to emergency departments. Like,
look after everything.
yeah, like after, and they look after everything, whether it's blood tests or, other things or medications, or just help them coordinate your care, because there's so much information you have to learn at the beginning. And honestly, if there was a place open at night, if you're just having trouble managing your medication or managing your intake or something, but not to go to Emerge, that's probably the worst place to go. And it seems like the only option here. So find help, advocate for good help, and basically feel comfortable with the doctor that you're with. Yeah, and just
Yeah,
be more.
juggling those logistics can be a real challenge, especially when you're dealing with multiple medications, multiple
Yeah.
appointments. Being frustrated with, how quickly you're being seen by the doctors, for sure. Yeah, thank you for
And
that.
all the medications, there was a lot of questions about the medications at the beginning. But there's
Mhm.
not, and if you don't get somebody in the daytime, it's really hard. And sometimes you don't get a call back that day. So it's hard to figure these things out.
Yeah, I think if they were to implement like this type of navigation system you're talking about, I think it would
Yeah.
actually end up saving the government money, and it would certainly make it a lot less stressful for the caregivers.
Unless the merge visits, right? And you don't want to be down there if you're
Yep.
immunosuppressed.
Exactly. 100%. So I'm going to answer the last question for my behalf. And then once I finish answering, it's not going to be a long answer. Then I'll pass it back to Aaron. So maybe we'll have some questions from the group. But my advice is to engage with an organization like Craig's Cause. And I'm not that just doing that to plug Craig's Cause, but I remember trying to reach out to a big organization in the country, and because they had a peer group for caregivers, and they would not let me in it because Ben was not yet officially diagnosed with cancer. So that left a really bad taste in my mouth. So reach out to an organization, reach out to people who are going to support you, make those contacts, learn what you can, if you can. I know some people it's hard to face it and to learn, but knowledge, from my perspective, knowledge is power. Don't lose hope. There are some amazing discoveries and research happening all over the world, even locally. Ben and I are in touch regularly with the research folks at the universities in Nova Scotia. There's some really promising things happening in the background, as are clinical trials. They're learning more things about cancer every day, and I'm actually quite optimistic that we're going to be finding some very effective treatments in the near horizon, which would be more like managing cancer, like you would manage diabetes or something. Lastly, and I can't stress this enough for caregivers in the room, look after yourself. As they say, when you're getting on an airplane and, if you're about to crash, put the oxygen mask on yourself first, because if you don't do that, you're not going to be good for the person you're caring for. So those are my final thoughts. And I just want to thank the caregivers here for participating. And this was, from my perspective, this was a great conversation. And I hope everyone listening got something from it as well. I know I did. Aaron?
Wow, thank you all so much. That was really great conversation. Really interesting to hear your perspectives, and I think just how strong you all are, and how kind and loving you all are to your family members. And I think that's just really amazing. I know in the chat we got a couple of people. Claudia said, "You're such a brave young lady, Bethany. I can just feel your strength and your deep care." Paul said, from when my mother was diagnosed in 2020 until her passing in 2022, the most heart-wrenching and painful thing for me was to see my sweet, beautiful, dynamic mother changing and be crushed by this horrible disease and all the treatments. Yeah, for sure, Paul. I'm so sorry you had to go through that, but I'm sure that this is, the group that can sort of sympathize with that. Claudia also said, I moved and touched the way all of you answered so openly and honestly all the questions, even it even brought up some memories. Thank you very much, and I wish you all the best. Thanks so much, Claudia. Thanks for coming, and thanks for the feedback. I think that's really great. Does anyone have any questions or comments or anything before we wrap up? Feel free to either type in the chat or unmute yourself. Okay, no worries. Well, thank you again, Karen, Bethany, Lisa, Linda. That was amazing. Really great conversation. And this will be going up on our website as well to rewatch. And yeah, I just thank you guys again for being so vulnerable and open and honest with your experiences. I think it's a really, really helpful conversation. Thank you everyone for attending as well. And I hope everybody enjoys the rest of your weekend.